If a patient or a friend or a colleague comes to you as a provider asking about whether they should get the vaccine, I think there are a couple of key things for you to think about in that conversation. One, I definitely encourage that if you are actively caring for a panel of patients right now, that you look at your panel of patients and determine their risk for becoming either extremely ill from COVID, being hospitalized from COVID, or ultimately dying from COVID. I think the second thing is, again, listening, really listening with empathy to your patients who are coming to you with vaccine hesitancy, trying to understand why they have those concerns. Is it based on historical mistrust of a system? Is it based on how fast the vaccine came to the market? The third thing that you can do is strongly encourage patients to get the vaccine. So don't be afraid to make a strong recommendation. Mr. Smith, I strongly believe you should get the COVID vaccine because you have diabetes and you are African American and you're over the age of 70, and all three of those things put you at a higher risk of hospitalization and possibly death if you were to get the virus. The last thing I would say is just make sure that there's follow-up. If the patient does agree to get the vaccine, make sure you're educating them about what some of those potential side effects are. Make sure they have an opportunity to reconnect back to you and they know how to reach out to you if they do have concerns or questions after they've received the vaccine.